Hey y'all, welcome to the Lamp and Light Fellowship of Nurses channel. I'm your host, Nurse Fran, and the goal over here is to equip nurses and also change lives. And one of the ways I do that is by offering one-on-one tutoring sessions in the areas or subject areas of pharmacology, med-surg, and fundamentals. But all of that aside, y'all, today we're going to talk, even though it may be briefly, I'm going to talk to y'all about careless nursing. And more specifically, I'm going to call it comfortable nursing. Because one thing about comfortable nursing is careless nursing. Comfortable nursing is dangerous nursing. Comfortable nursing is lazy nursing, y'all. And it will only hurt your patients, right? And not only will it hurt your patients, but it's also going to hurt you. You're going to find that if you are comfortable, you're going to be careless. If you're careless, you're going to be lazy. If you are lazy, there is no way around you being dangerous. You cannot be dangerous in the area of nursing, in the profession of nursing, because people's lives are literally in our hands. Nurses are one of the most trusted professions in the world. So you got to think about it on that perspective, that people are literally entrusting their lives to you, right? So if people are entrusting their lives to you, y'all, that means that you should not be comfortable, that you should not be lazy, you should not be dangerous. Those are things that you just cannot afford to be. And I don't care how long you've been a nurse. I mean, you should not be comfortable. You should not get comfortable. And when I mean comfortable, it's like you throw safety out of the window, right? Because you've been doing it for so long that you think you can override evidence-based practice, right? You think you can override all the safeguards that are in check because you got away with doing it one time and nothing happened that first time, right? And you did it again and nothing happened that time. So you keep on playing Russian roulette with people's lives and with your license because you got away with something maybe more than one time. But you should not continue to operate like that. So we're going to throw comfortable, careless, lazy, dangerous out the window today. If you're in nursing school and you see these things happening, look, don't do it. I don't care how long Nurse Susan or Nurse Ratchet has been doing so and so. Don't do it. If it's not in the textbook, like as far as a nurse, like look, when you're in nursing school, when you take your NCLEX, and even in sometimes in nursing school when you get your exams, right? They're not testing you on what you see happen in the real world. They're testing your textbook knowledge because the textbook knowledge is the evidence-based practice. The textbook knowledge is what has been proven to be safe. When you get your license, they want to prove that you are a safe nurse. So just because you've seen your preceptor do something, that does not mean that it's right. Just because they do something one way in the real world does not mean that it's right. So you want to remember textbook. You can never go wrong with answering a question according to the textbook. So there's just a hint on NCLEX. It's always according to the textbook knowledge, okay? So one of the ways that nurses get comfortable is in their med pass, right? You don't want to get comfortable. One way that you get comfortable, you're on your phone. If you're at work, put your phone down. Your patients deserve your undivided attention. You're giving out medications. Some of these medications can actually take a patient's life if not given safely. So, and you're giving insulin. You don't want to give them too much insulin. Even when you give 1 unit of insulin, you got to verify with another nurse. So just think of what would happen if you give a patient too much insulin. And you want to be lazy and like, oh, it's just one unit, so I'll give it. But you were supposed to have it verified, so don't get comfortable. Stay off of your phone while you're at work, right? When you take your breaks, you can use your phone. And understand if you have small kids and they may have to call you, or there may be an emergency. So I'm not saying that you cannot tend to an emergency, but scrolling on Facebook during your med pass, having on your phone while you're literally on your med pass, and your phone is right there. You're watching YouTube videos, social media, whatever, while you're getting the patient's medications ready, while you're preparing their medications. That's dangerous and it's lazy, y'all. We're not going to do dangerous. We're not going to do lazy. We're not going to do comfortable. We're not going to do careless. We're going to do safe nursing. That's the goal. I encourage, whether you are a nursing student or whether you are a practicing nurse, a novice nurse, or a seasoned nurse, I encourage safe nursing. Because when you get into a courtroom, and God forbid you should ever have to be a litigant in a case, right, or a defendant in a case, but you gotta make sure that you're being comfortable, because the safety measures are put in place not only for the public but also for you too. So make sure you're going by the textbook. Make sure you are practicing safe nursing. I just cannot stress that safe enough, right? Safe nursing is always the best nursing. Do not get comfortable. Do not get careless. Do not get lazy. I don't care how long you have been a nurse, you cannot afford to get comfortable. Because just as quick as the state board gave you your license, they'll take them back even quicker. And for some of y'all, I know that you were waiting on, depending on the state that you live in, you were waiting to be licensed sometimes even for months. It'll take months for you to get your license. But baby, you better trust and believe it's probably not going to take that long for them to take it away when you have done something. And if you have to go before the board and they have to take it. And sometimes if you do something that is safe, they'll take your license. You can never practice nursing again. So you want to make sure that you are doing what's safe. Again, it does not matter what you see nurse so-and-so do. You're not imitating nurse so-and-so just because she has been a nurse for 35 years. Just because she has been a charge nurse for 10 years, it does not matter, because she has an MSN behind her name, or a DNP behind her name, or an FNP-BC or FNP-C behind her name. We're not caring about that today. It's all about safety, y'all. So make sure that you're staying off your phone. And also another thing is, as a nurse, look, you should not be walking around with a pocket full of wristbands in your pocket. Why? Why do you have them? Like you collecting kids or something? Come on now. The wristbands do not belong in your pocket. Sometimes nursing and nurse, I know you can work hard as a nurse, but y'all, this is what we signed up for. So just because we work hard, that's not an excuse for laziness. Working hard is not an excuse to cut out steps. So working hard again and being busy is not a go past jail free card, right? So just because you are busy, that's not an excuse. Sometimes you got to slow down. Sometimes you got to regroup. I get that, right? Sometimes you just need to take a break. But y'all, all I'm saying, don't be careless. Never put patients' wristbands in your pocket because you were just simply too lazy. And what it all boils down to, because we're going to keep it real today. Some of y'all might not like me after today, but we got to keep it real. You have the wristbands in your pocket because sometimes you are just too lazy. And you don't want to take those 2 or 3 extra steps. That's called laziness. That's called being comfortable. That's called being careless. And it's called being dangerous. And if you ever have to go before the state board, guess what? Baby, nurse so-and-so, or I was busy. And I was tired and there was so much going on. So I just put the wristband in my pocket. That's not going to fly. So we're not putting wristbands in our pocket. If we're doing that, we're not doing that anymore. You got to put it in your mind that you have worked too hard to get this nursing license, right? Your kids are dependent on you. Too many people are dependent on you to do what is right. Because that's one thing about being a nurse. You have to walk in integrity. Walking in integrity means that you are doing what's right even when nobody is looking. You're doing right. Because guess what? The eyes of Yah in heaven, he's always watching you. So even if you do it just for that, know that his eyes are watching you. Even though the charge nurse's eyes might not be on you, right? Even though your nursing manager or your nurse supervisor eyes may not be on you, the greater above, his eyes are on you. Always do what's right. Y'all walk in integrity. That's part of being a nurse. And when you take an oath and you say that you will do no harm, y'all, we are not to do any harm to these patients. So if you say that you're not going to do any harm and putting their wristband in your pocket because you're too lazy to get up and walk 2 and 3 extra steps, or you don't want to go from this room to that room, so you decide you're going to scan all of the medications at the nursing at the desk, which you shouldn't be doing it because that's dangerous too. Put your eyes on your patient. Open those medications in front of your patient. Tell the patient what you are giving them. You owe them that much. They may want to refuse. And what if you have opened up all these medications and the patient will be like, oh, I don't want to take this. And you don't know which one is which. So what are you going to do then? Scan the medications in the patient's room. Okay? We got to be safe. Because again, patients are depending on you. And God forbid you have their wristband in your pocket and you were to give, let's say, heparin to somebody, to one patient, and you scanned so-and-so, or so like a low molecular weight heparin and the sub-Q heparin. You were to give it to patient so-and-so, right? And you scanned their wristband, but when you were going to give them the medication, you got a phone call. So you went back to the nurse's station, took their phone call because they said it was important. And then you forgot you were going into the room because now after you got the phone, the call light is in your other room and there are no aides around to help. So you go into that room and you mistakenly give that patient the heparin, even though that patient may have been in for a GI bleed, right? Careless nursing will kill your patients. And it will unalive your patients because I probably can't say that on YouTube. Probably will be censored, but careless nursing can unalive your patient, y'all. It will have you thrown in the jail, thrown under the jail. Everything that you worked hard for, you're literally throwing it out the window. You're throwing your patient's trust out the window. So be safe and not comfortable. Be safe and not careless. Be safe and not lazy. Be safe and not dangerous. Y'all, we got to be safe. What else can be considered like comfortable or careless nursing? Sometimes letting your licenses expire, because we know that we get busy and sometimes you want to wait till the last minute at the umpteenth hour because you've already missed the original deadline. So now you're in that little grace period where you have that month. And if you don't have it renewed by then, because in that month's window, they charge you an extra fee. And even then, you haven't even renewed your license. So now you're about to be without a license because you did not renew on time. And I hate to say it again, but we got to keep it real. That's lazy. You work too hard for these licenses, y'all. I don't know about y'all, and I have been that lazy nurse before, waiting till the last minute. And that puts a lot of undue stress and pressure on yourself trying to get those CEUs in at the last minute, trying to read this article at the last minute, trying to read that article at the last minute, right? Trying to make sure you get all those hours in at the last minute. I've done that before more than one time when I could have started earlier in the year and could have been getting them throughout the year, but I waited to the last minute. So waiting to the last minute, y'all, that's going to cost you a lot of extra money. It's going to cause you some headache. It's going to cause you sometimes some physical sickness in your body because you're stressing yourself out. But these things can be avoided, right? You're going to find in life that you're going to miss a lot of opportunities. And this might be kind of like off the subject, but sometimes you can miss a lot of opportunities in life simply because you wait to the last minute, and it's called procrastination. Let us not procrastinate, y'all. Let us stop procrastinating, thinking we have all the time in the world, because we do not. So somebody else that can be more prepared than you, they might not have more experience than you or more head knowledge than you, but they were on time. Just being late for everything. I was that nurse, always running, and I feel like, look, if I'm here my schedule says I got to be here by 9. My appointment is at 9. I was there at 9. Or my appointment was at 9. I got there at 9:05. My interview is at 10. I get there at 9:57. And if it came down to it, right, if me and another let's say if somebody that was interviewing for a job, they may get the job. They might not have more experience than me, but we were going neck and neck, and they were trying to. The deciding factor for the interview was who came, who showed up to the interview earlier, and they got it simply because they were earlier, right? So what I'm saying, don't miss out on opportunities because you are too lazy. I'm talking to you as I talk to myself. And as somebody who used to be lazy and wait to the last minute to do a lot of things, I can come to you and encourage you and say, like, look, sis, look, bro, that's not the way to do it. Don't wait to the last minute. So if it's like that in real life, when it comes time to renew your nursing license, don't wait to the last minute. Don't wait to the umpteen hours. So even now, I don't wait to the last minute to get my CEUs, right? Because we're not doing it over here. We have worked too hard, y'all. We work too hard, too many sleepless nights, and a lot of you in nursing school, too many sleepless nights. You have sacrificed a lot for your family. You've given up on a lot of things. You have been going broken without for a while so that you can get your license. So when you get your license, make sure you do everything that is within your power to keep your license. Which brings me to this point. Comfortable nursing or lazy, careless, dangerous nursing is nursing that does not learn. I mean, you learn, but you pick up articles, you read them only because you want to get that continuing education hour, but you're not reading it to learn. Nursing and healthcare, you got to stay abreast of what's happening in healthcare because healthcare is forever changing, right? There are always new interventions. There are always new procedures, new equipments, new medications, new this and new that, and you got to stay on top of these things. New IV pumps, new Foleys, new catheters, new this, new. Before you knew, right? So you got to stay aware. You got to stay abreast of what's going on. So not choosing not to be knowledgeable about medications and disease processes. That can be. Sometimes being ignorant of things is comfortable, but being ignorant and comfortable is lazy and dangerous. So you want to make sure that you are always educating yourself, right? Because an educated nurse is an informed nurse. And as a nurse, we always want to empower our patients. So one of the ways that we do that is we educate them on the disease process of what's going on, right? So educate yourself. You want to be promoted? Educate yourself. You should always be learning. We have to learn, y'all, because life is forever changing. And when you get to the point that you don't want to learn anything new or you're not willing to learn anything new, that's being very dangerous. And it's being careless. And I'm not saying any of this to condemn anybody, because here comes the preaching. I'm not saying this to condemn y'all, but y'all, we got to be safe, right? We have got to be safe. So if you find that you are doing any of these things, if the shoe fits, baby, put that shoe on and walk it out. If the shoe fits, even though it might be comfortable, say ouch and keep on moving. So from here on out, if you know that you have been putting those wristbands in your pocket, don't do it anymore. If you know that you've been waiting to the last minute to get your CEUs, don't do it anymore. Start months in advance. And let me tell you, when you start months in advance, getting those continuing education hours is so much easier. So less stressful, right? And also continue to learn, because knowledgeable or informed nursing, educated nursing, y'all, is safe nursing. You can't go wrong with being safe. There are safety mechanisms in place, not just for the public and for the patients, but for you as well. And the last thing I'm going to say, getting comfortable. Because sometimes as a nurse, you can get comfortable, baby, and not wash your hands. I've seen it in the hospital many times. Nurses and doctors going from one room to the next, touching on patients, touching on doorknobs, touching on this and touching on that, and not washing their hands. And that's how infections are spread, y'all. So, in order to prevent infection, wash your hands. That's the easiest way. If they're not visibly soiled, okay, you can go from one room, enter in the room, before you go into the room, cleanse them with the alcohol, right? When you go out, cleanse them again. If your hands are visibly soiled, if they are visibly dirty, wash your hands. If tending to a patient that has C. diff, look, and no amount of hand sanitizer is going to get rid of that C. diff. Baby, you have got to wash your hands with soap and water to get that mess off your hands. Wash your hands with soap and water if you have to. And alcohol does not kill C. diff. So anytime you're working with somebody with C. diff, always, always, always wash it with soap and water. So make sure you are washing your hands. Make sure you are cleaning your hands on entry and on exit from each room. I don't care if you don't touch the patient, because you might be touching something in the room. If you're touching the doorknob, because everybody that goes in and out patient's room, they don't clean their hand and they're touching doorknobs. A lot of the times, patients don't want their doors open, so of course you're going to have to open and close them on the way out. So just make sure, y'all, in order to prevent infection, that's the cheapest, most effective and efficient way to prevent infection. Adequate hand hygiene. So make sure you're practicing adequate hand hygiene. So those were just like 4 ways to not fall into the habit of becoming a lazy or a lazy nurse, or a comfortable, careless nurse. And comfortable, careless, and a lazy nurse is a dangerous nurse. And if you're dangerous and you don't want to stop being dangerous, you should not be practicing. It's simply stated. Like, you are a danger not only to others, but you are a danger to yourself. So all of these things can be prevented, y'all. So if you find that you are doing these things, again, I'm not condemning you, but I encourage you, because as you know, I'm encouraging. I love to encourage people to do better, right? And I love to encourage myself to do better. And sometimes it takes encouragement and reminders, sometimes more than once. So just let this be a reminder. And also, like I said earlier, I do offer one-on-one tutoring sessions in the subject areas of pharmacology, med-surg, and fundamentals. So if you need help understanding any of those, feel free to book a one-on-one tutoring session. You can go to the website. It's www.lampandlightnurses.com, and over there just click on the services tab. But I also have other products that I'm working on, and also interview preparation. I do that if you're going on an interview, to help you get ready for your interview. We can do a mock interview. You dress up for the interview. I'm going to dress up. I'm just going to be like somebody that's interviewing you. I'm going to ask you questions. I'm going to give you pointers. That's what we do in that mock interview. And also I also help write your resume, help you proofread your resume to make sure it's up to par, right? So that you can stand out, so that you can be called in for that interview. And I also, because in nursing school, time management is of utmost importance. And literally, time management can make you or break you. And I have written a book called Time Management Tips for Nursing Students. So it's going to help you effectively and efficiently manage your time while you are in nursing school, right? And even you don't even have to be in nursing school, because the book is only 5 chapters long. If you're in college, it helps you. And even just professionals, it helps you. There are activities in the book that help you recognize like distractions, also ones that will help you, like a time tracking activity. It helps see where you are spending your time and help you cut out like things that really are not important, right? Also, it's an activity to help you kind of reclaim time. Like, so there may be things that you want to do in nursing school, you're not able to do it because you feel like you don't have enough time. But sometimes it's all about reallocating our time, doing things that, getting away or getting rid of some things that take up too much time to clear up our time or our schedule, so we can do some of the things that we want to. Because even though nursing school is hard, you do want to have some type of pleasure outside of nursing school. Like, all work and no play, like there was on The Shining. All work and no play makes Jack a dull boy. So you do not want to just always be just busy and never have any downtime and never doing anything that you don't like, right? So make sure you go check that book out. It's also on the website, www.lampandlightnurses.com, but it's under the shop tab. So just make sure you go over there. If you have not subscribed to the channel, go ahead and subscribe to the channel. And let me know in the comments if this video has helped you at all, right? Please just put something in the comments. Please leave a comment so that YouTube can pick it up on the algorithm and show it to other nursing students. Like, I really try to put time and efforts into these videos, y'all, but please just watch them. Please share them, because YouTube is not going to do it automatically. So as I help y'all, I'm just asking that you would please help me by sharing the videos. Also commenting on the videos. So leave a comment, subscribe to the channel, and let me also know in the comments what you would like to hear in future videos. And y'all have a blessed and prosperous week, and bye.